Hello again everyone! We are now at our final episode, and in today's video, we will talk about how we can utilize electronic medical records to deliver advanced and efficient healthcare management, and how EMRs can provide a better means of monitoring patient health, measuring quality of care, and bringing medical research to the bedside. With different departments, programs, specialties, and complex equipment, hospitals need a way to seamlessly manage and share information across these different areas. However, maximizing effective and efficient patient care can be difficult, especially for hospitals that still rely on small budgets and on paper-based records, like our current Philippine healthcare setting. This is where open-source hospital management software comes to play. Not only for the patients, but also for medical professionals and the healthcare system as a whole. A hospital management system integrates all information and data related to doctors, patients, staff, and departments, and provides a way to securely and seamlessly streamline processes of care, which in turn helps them function systematically and manage information effectively to offer better patient care. Today, we will be utilizing an open-source hospital management software called OpenMRS, which offers a solution for hospitals and clinics of all sizes and budgets to help them move in the right direction for their staff and most importantly for their patients. But before we explore what the demo has to offer, I have interviewed one of my family relatives to be the subject of my primary nursing resource to be utilized in the OpenMRS. After informing them of what their information is being used for and who will have access to it, they gave me the consent to use his data for this learning activity, with the prerequisite being that I do not address their identifying information and physical attributes to the audience. First and foremost, let me give you a quick run-through of the open source platform we will be using, which is OpenMRS. OpenMRS was initially launched as an application built to support HIV care in Kenya and Rwanda, but it then later developed further to offer a full-fledged EMR system with open-source patient management, document, workflow, and cohort management, user-based security, flexible reporting system, customized electronic forms, HL7 standards compliance, modular framework, and multi-language support are some of its significant features. For our demo presentation, I have outlined a workflow that will act as your guide toward navigating around the application. Having a technology-based workflow in mind, especially in the clinical setting, helps improve coordination of patient care by automating your clinical workflow and service lines so that it proactively manages your critical actions and data points, providing real-time accessibility to information from within workflow views. So now I'm going to open up OpenMRS at www.openmrs.org/demo, and I'm going to input the username and password the site has provided, as this is only a demo of the actual application. And I'm going to select my location as inpatient ward, hypothetically. Next, we're going to register the patient to the patient database system of the demo, as they are deemed as a person who hasn't been admitted to this specific healthcare center. We're going to enter his name, not his real name since he didn't consent to it. So I used this favorite fictional character in lieu of his actual name. Add the values as follows, such as his birth date, his address and where he currently resides, his active phone number, and whom the patient is related to. Here I added his wife and child as his relatives he came in with to the hospital. Be sure to double check your patient information before saving it, since double checking helps catch problems before they cause harm to the patient. As such, often prevents the reporting of near misses. Now I can see the patient's info when we drop down this section. Next, we're going to click Start Visit and then Admit to Inpatient, which directly translates to a patient's hospital admission process in the healthcare setting once they enter to receive treatment or care. I set it to the date today and added the appropriate values, then click Save. This classifies the patient as an inpatient client, and care tends to be directed towards more serious ailments and trauma that require 1 or more days of overnight stay at a hospital. Next, let us capture the patient's vitals according to the objective cues you have gathered during your nursing assessment. Be sure to use caution when adding numerical values to electronic medical records, especially when applications like these do not have additional error prevention features. Again, confirm your set values and then click Save. Next, we are going to add a visit note for the patient, and you usually fill this out while you are in the middle of a patient interview process to prevent overlooking or forgetting to add significant data. As we assess the medical history of the patient, we can then define their primary or medical diagnosis, which determines the disease or condition that explains a person's symptoms and signs. From his verbal cues and objective data gathered from laboratory tests and doctor's prescriptions, we have ruled out that the patient has iron deficiency anemia. As it is out of the scope of practice for a nurse to define and create medical diagnosis, we can look up about certain diseases by using internet databases and certified web sources that can guide us in creating our nursing care plan. First, I have used the scholarly database PubMed to describe and characterize to me the medical diagnosis of the patient, which is iron deficiency anemia, in order to have a background on it and so that I know what to look for as I assess my patient. Another resource I have found helpful and significant was MedicineNet, a medical website that provides detailed information about diseases, conditions, medications, and general health, written in easy-to-understand language for the public, and it is a helpful tool for student nurses like us. After inputting the primary medical diagnosis of the patient, it is now time to create our nursing care plan and embed it in the clinical note of the page. First, I will describe my assessment findings and categorize them as subjective and objective data. For the subjective data, the patient had highlighted their chief complaint by saying that they feel very weak and just plain tired, which is proportional to what MedicineNet.com says that are clinical manifestations of anemia. Inability to climb stairs to the bedroom and perform ADL, complaints of cold, numb feet and hands constantly, complaints of dizziness are all subjective cues assessed from the patient. The patient's objective cues, on the other hand, are observable and measurable data obtained through observation, physical examination, and laboratory and diagnostic testing. The most significant data associated with the patient's condition is added in the nursing care plan, to which we will be identifying next. Nursing diagnoses represent the nurse's clinical judgment about actual or potential health problems or life processes occurring with a specific patient. One purpose of nursing diagnosis is that it provides a precise definition of a patient's problem that gives nurses and other members of the healthcare team a common language for understanding the patient's needs. We use standards of the North American Nursing Diagnosis Association, or NANDA, to define our nursing diagnoses, and I have been able to identify this diagnosis. Activity intolerance related to verbal complaint of generalized weakness as evidenced by imbalance between oxygen supply and demand, secondary to anemia, which is unique and specific to this particular patient. After defining the nursing diagnosis, we must now formulate client goals and design the nursing interventions required to prevent, reduce, or eliminate the client's health problems. The next step is to map out goals for the patient for both the short and long term, and I have outsourced information from the web sources Nurses Labs and RNpedia to help me identify and idealize my desired outcomes for my patient. Here are my main short-term and long-term goals described in my nursing care plan for my patient. Next on the care plan process are nursing interventions, which are the actual treatments and actions that are performed to help the patient reach the goals that are set for them. By sourcing relevant information from Nurses Labs and RNpedia once more, I have labeled 6 nursing interventions that will maximize specific patient care to facilitate my desired nursing outcomes more effectively. Here are my outlined nursing interventions and their respective rationale to explain the medical, nursing, psychological, or the pathophysiological reason why the intervention is to be carried out. And for the final section of our nursing care plan, we must highlight the nursing evaluation, which is used to assist in judging how well my nursing interventions are working. It can inform decisions about the effectiveness of nursing care and what changes could be considered to improve care delivery. Since my patient has only been admitted recently, I have no basis to create a nursing evaluation just yet. So I will input it as soon as I perform my designated nursing interventions to my patient. Then click Save. And now the information is highlighted in the patient dashboard. I then proceeded to check if the patient was indeed documented and saved on the website using the Find Patient Record tab on Home. Now let us add the patient's allergy information. And although my patient stated that he has no known allergies, let us see their allergy library. And I am surprised how much information there is, especially the allergen reactions. Next, we can decide whether we would like to add attachments. And here, I will be adding the patient's laboratory results and writing its metadata as caption. The RMC Health has labeled and highlighted some rubrics to which I will use to assess my skills in accessing information on the web, as we student nurses need to demonstrate the ability to access valid information and products and services to enhance health. As I have utilized different web browsers and looked up on a well-known and credible database, I have been able to locate very specific sources of health information that is especially relevant for enhancing my patient's health, as I have used to plan for their nursing care. By utilizing the search tab feature in each browser, I was able to specifically find the pertinent information I desire and thereby utilizing it on my nursing care plan elements. To further validate my gathered information resources, I check each of the web sources policies, authors of the material, year the website's copyright date were updated, the accuracy of information as cross-referenced in books, and whether there is an absence of grammar and punctuation mistakes. All of these criteria must be present in order for us to evaluate these websites as reliable resources. The data I have also gathered is reflected in my usage in the nursing care plan, as well as citing the sources where I have gathered my research from as footnotes. To conclude, electronic medical records has changed healthcare as we know it, as it continues to improve quality of care, patient outcomes, and safety through improved management, reduction in medication errors, reduction in unnecessary investigations, and improved communication and interactions among primary care providers, patients, and other providers involved in care. Although some hurdles are concerned about implementation costs and time, especially in countries like the Philippines, it has significantly improved efficiencies in workflow through reducing the time required to pull charts, improving access to comprehensive patient data, helping to manage prescriptions, improving scheduling of patient appointments, and providing remote access to patients' charts. In summary, we must always keep in mind that progress is impossible without change. And unless we as a nation progress towards the fast-paced technological world, then we will rather regress and be stationary, while the whole world walks forward. That is all, and thank you for letting me educate you on EMR utilization. I'll see you soon, and remember to always be a work in progress.